Hi, this is Shelley Kraft. We're coming to you live on SNNLive. We're at the FSX conference, and we're in Phoenix, Arizona. I'm here with Dr. Steve Quay of Atossa Genetics, Inc. It's a private company. Steve, how are you?
I'm good, Shelley. It's good to see you again.
Now, let's talk about Atossa. And I want to get into a little bit deeper than, average. I want to know about the product.
Okay. Well, the company's product is very straightforward. It's a diagnostic screening test for women at high risk of getting breast cancer. But it works in a process that gets ahead of the breast cancer. It picks it up about 8 years before mammography.
FDA approved, correct?
That is correct.
Which is big, because you're not a startup.
That's true. We expect to launch in the first quarter of 2011.
So that means hypothetically, and I'm not trying to sound smart, because that's difficult as it is. If I am a woman and I go in for this exam, I'm going to know 8 years ahead of time that I'm good for 8 years.
Well,
or maybe not good for 8 years.
Yeah. What the process does, it takes about 10 minutes. It's painless, but we collect a small amount of fluid from the nipple of each patient, and then we look at it under the microscope for changes that will lead to breast cancer if they continue. So either they're completely normal and they can come back in the following year, or if there's something abnormal, we may want to intervene.
What's really interesting is, in this day and age of storing medical information and having the ability to have that sample recorded within your documents or what have you in your storage facility, so they could come in during a regular, mammographies are once every year?
Yes, depending on age, it's once a year or once every 2 years. Pap smears are typically every year.
So they could come in and they know for 8 years in advance what the situation is, and now you've got a history of these exams now going forward, correct? Just like you would a regular mammography.
That's right, that's right. Probably the best example is the pap smear, which is the most successful screening test in the history of medicine. The changes that occur that lead to cervical cancer take about 10 years, and you can see them each year during that annual exam. We want to do that for breast cancer.
Now, obviously, breast cancer is a very large killer of women. And anything in that science, in that medicine that advances, first of all, detection, second of all, treatment, is world-shattering. What do you feel about that statement?
Well, I'm pretty excited about it because I think it's correct. As we know, 1 woman dies every minute of breast cancer, so it's an acute medical problem. Up until now, we haven't been able to do anything in the way of seeing those precancerous changes. Mammography picks up a lesion after it's already cancer. You're doing surgery, radiation, and chemotherapy at that point in time. Our test will pick up precancerous changes when you can hopefully prevent cancer from ever occurring.
What is your website?
www.atossagenetics.com.
And obviously, for women, check it out. What is your background?
I have a medical degree and a PhD in chemistry from the University of Michigan. I trained at MIT and Harvard, taught at Stanford for about 10 years. I'm a licensed pathologist. This is my 5th company. I've invented 5 drugs that have been used in 60 million people.
Anything else? Have you taken over a small country? What?
No, I'm pretty dedicated to trying to improve health for people in important diseases.
You're well known. You have a tremendous background. And I'm sure that, let's give that website one more time, because it's really for women and family members to go and check out, because you'll probably have, this is on the market. They could actually go and get this test, can't they?
That's correct. The important thing about breast cancer is because women are the glue of society so much, it's not just a woman's disease, it's a family's disease, it's a disease of all their friends and relatives.
Okay, one more time for that website.
www.atossagenetics.com.
Doc, thanks for coming on to SNNLive.
Thank you, Shelley.
It's a pleasure to have you. You're doing great work.